Hello friends and welcome back to my YouTube channel. So today we are going to discuss about the hypokalemia. So hypokalemia it refers to the low potassium level in the blood which can have significant effects on the muscle function, heart rhythm and overall health. So in this video we will cover what is hypokalemia, what are the functions of potassium, what are the causes, its symptoms and its treatment. So, if you're ready to understand how this condition affects our body and how to manage it, stay tuned. So, first, we will know about the functions and its normal value. So, if there is a more potassium in the body, there will be less sodium, and if it is less sodium, there will be more. If it is less potassium, and there will be more sodium. So, what are the functions of potassium? So, potassium will helps in the transmissions of electrical impulses, particularly in nerve, heart, skeleton, intestinal, and lung tissue. It also helps to maintain the cell functions and resting membrane potential. Potassium helps to regulate the electrical charge across cell membrane, which is essential for proper cellular function. How it helps in the muscle contraction. It is crucial for muscle contraction, including heart muscles. Low potassium can lead to muscle weakness and cramps. And nerve signal transmission, potassium is involved in generating and transmitting nerve impulses, which is necessary for reflexes and voluntary movement. It also helps in the carbohydrates metabolism and cellular building and maintenance of cellular metabolism and excitation. It also assists in regulation of acid-base balance by cellular exchange with hydrogen. Sources of potassium: bananas, peaches, kiwi, fig, dates, apricot, oranges, melons, raisins, broccoli, potatoes, meat, and dairy products. So these are the sources of potassium if we should add these sources in our diet. Now we will see the normal value of potassium. So normal value of potassium is 3.5 to 5 milliequivalent per liter. So if this level goes down, means like normal value is 3.5 to 5 milliequivalent per liter. So if potassium value will go, or potassium blood level will go below 3.5 milliequivalent per liter, it can leads to hypokalemia. So patient can be, if the patient will have the mild hypokalemia, it will be asymptomatic, and sometimes it also causes to acid base disorders. And if the patient will have the severe hypokalemia, it can be life threatening for the patient. So the serum level is below 3.5 milliequivalent usually indicates a deficit in potassium store. Now we will see the pathophysiology. So as this potassium is helpful in the resting membrane potential at rest inside of the cell is more negative than the outside. So primarily due to the high concentration of potassium inside the cells and the sodium outside the cell. So potassium channels allow potassium to slowly leak out of the cells and maintaining resting membrane potential of about 70 MB. So if the action potential is there, that to the nerves and muscle activity. And if there is a low extracellular potassium, it can leads to increase in resting membrane potential and the cell will become less excitable. Other thing is, if there is a aldosterone is created, so aldosterone what it does, it will reabsorb the sodium and water. So if there is a more sodium in the body, there will be less potassium, so potassium will be excreted out of the body. Then there will be, if we are using, if the patient is on thiazide, furosemide or corticosteroid, these type of drugs, these drugs will increase the urine output, and potassium patient will have the potassium loss in the urine. Then the sign and symptoms. What can be the sign and symptoms patient will have? So first one is the alkalosis. Alkalosis means patient's pH level will increase. So normal pH level of the blood is the 7.35 to 7.45. So if this level will goes up, patient will have the alkalosis. Then patient will have the shallow respiration, irritability, confusion, weakness, arrhythmias, irregular heart rhythm, lethargy, thready pulse, and decrease the intestinal mobility. Next is the medical manage. How we can manage this condition? So we have to administer 40 to 80 milliequivalent per day OD of potassium is adequate for adults. If there is no any abnormal loss of potassium, then dietary intake of potassium is average adult is 50 to 100 milliequivalent per day. When dietary intake is inadequate for any reason, oral or IV potassium supplements may be prescribed. Then nursing management. So nurse needs to monitor the patient very carefully or early signs of hypokalemia so that we can prevent the patient from further risk. Patient, if we are noting any fatigue, anorexia, muscle weakness, or decreased vowel mobility, paresthesia, that is the lack of sensation, dysarrhythmia, that is the irregular heart rhythm, these are the some of the signals that will warrant assessing the serum potassium concentration. So if we'll found all these signs and symptoms, we should notify it to the physicians, and accordingly we have to treat all these things. So this is all about the hypokalemia. What is hypokalemia? What are the functions of potassium? And what is the pathophysiology? What signs and symptoms it can cause, and how we can manage this condition? So if the patient will have the severe hypokalemia, it will be life threatening for the patient as it helps in the muscle contraction and nerve excitability. So this is all about today's video. So let's, if you found this video helpful, don't forget to like and subscribe for more content on health and medicine. Also, feel free to drop any question or thoughts in the comment below. I would love to hear from you. Thanks for watching. I will see you in the next video.